Hi, it's Dr. Centeno, and I'd like to get into today what I call a fragile egg patient or central sensitization. So what is that? How does it impact procedural-based care, something like a PICL or really anything we do, any procedure we do? And are there ways to mitigate that effect? So central sensitization is now well known. What it means is that the patient's central nervous system is on fire. To put it another way, maybe a more scientific way, is the threshold for causing pain is dramatically lower. Now, why does this happen? Some of it is genetic, some of it can relate to nerve or spinal cord injury, and some of it we can't understand. Maybe it's related to higher systemic inflammation, for example, or neuroinflammation. But the bottom line is that when it occurs, patients respond very differently to everything, including procedural-based care. So how would you know if you're a fragile egg or centrally sensitized? Well, for example, I did a physical exam on a patient and just pressed on the low back area, and they said that it took 3 months to calm down. That's a fragile egg or essentially sensitized patient. Or if you get a massage, it can set you back for weeks. Or if you get an injection, rather than the 1 or 2 or 3 days being sore, you're sore for weeks or months. So this basically means that we have to take a less is more approach with that patient. And what I mean by less is more is very simply we do less until we can do more. So for example, let's say we had A, B, C, D, and E planned, or we need to do those things, but we might do only A or A and B until things calm down and we treat the problem some more, and then we can add in A, B, and C, and then maybe A, B, C, D, and E. That's a great example. So at the end of the day, it just means doing less up front. Now, sometimes medications can help. Lyrica is probably the best medication out there that can reduce central sensitization pain, but it's not a long-term solution. So at the end of the day, if you have been told by me or one of our clinic staff or another doctor that you're centrally sensitized or that you're a fragile egg patient, that's what that means. And it's not the end of the world. We can still treat things, but we have to take that less is more approach. Thanks so much for watching and have a great day.